Hello, I'm Dr. Richard Gould, Associate Medical Officer of Health for York Region. We welcome the provincial announcement to enter Step 2 of its roadmap to reopen framework later this week. However, residents are reminded to continue to be vigilant by following public health guidance and applicable gathering limits and restrictions, even if you've been vaccinated. I also remind residents to please get tested at one of York Region's assessment centers if you're experiencing any symptoms of COVID-19, even if they're mild and even if you've been vaccinated. York Region continues to make excellent progress in the distribution and administration of COVID-19 vaccines and has administered more than 1 million vaccine doses as of last week. To continue our immunization efforts, this morning, 31,000 new COVID-19 vaccine appointments were made available for all individuals age 18 and older who live, work, or go to school in the York Region, and all individuals aged 12 and older who live, work, or go to school in York Region and have not yet booked a first dose appointment. These appointments can be booked online or by telephone by visiting york.ca COVID-19 vaccine. Additional appointments will be released as vaccine becomes available. Residents are encouraged to check back often. You may be aware of the province-wide delay in Pfizer shipments. However, this week's appointments are not impacted in York Region. Contingency plans are in place should our Pfizer supply run low or out. This includes reallocating Pfizer where needed and administering Moderna to individuals age 18 plus who have a first dose appointment booked. Both the Pfizer BioNTech and Moderna mRNA vaccines are over 90% effective at preventing serious illness and death due to COVID-19. The National Advisory Committee on Immunization, or NACI, considers these mRNA vaccines to be interchangeable. The Ministry of Health encourages all people living in Ontario to get their second dose as soon as possible with the recent increased circulation of the Delta variant across the province. If the vaccine you received for your first dose is not available at your second dose appointment, it is recommended you receive the mRNA that is available rather than delaying your second dose. Individuals who received AstraZeneca as their first dose can choose to receive the second dose of AstraZeneca or an mRNA vaccine as early as 8 weeks after their first dose with informed consent. The mRNA vaccine provided at clinics will depend on the current supply of vaccine. With the possibility of delayed delivery of Pfizer, many clinics will be offering Moderna vaccines as second doses. As for the second doses for youth ages 12 to 17, at this time, York Region will be maintaining the timing of the second dose of the COVID-19 vaccine for this group to between 8 and 16 weeks. Some York Region youth may already be eligible for their second dose of Pfizer, particularly youth at higher risk due to health conditions or for young adults who are unable to work from home. Accelerated second doses of the COVID-19 vaccine for those 12 to 17 are available through the provincial booking system and participating pharmacies. The priority continues to be administering first doses for youth and for adults who have yet to be vaccinated. It remains critically important for all those who have not received a first dose to get, and when it's your time to get a second dose, please wait your turn, but when it's your turn, don't wait. Stay safe, stay informed, stay vigilant, and please get vaccinated.